them employed at the counties or at different facilities. Most of them, you know, in terms of career progression, they would like to specialize into specific. Medical officer, maybe one wants to be a gynae, one wants to be a surgeon and physician and all that. So government has been paying and it continues to pay, but we are in arrears.
Okay.
So there was an issue where the university had said that it will not give exams to all those with arrears. In our Monday morning, and that is why I said it was a good meeting, from that discussion, the PS for Medical Services, Kimtai, is going to sit with the Vice Chancellor to reconcile the arrears.
Okay.
And we have committed, we have money now in the budget to pay all those arrears. So by the time the doctors are going to sit for their exams in September and October, there will be no arrears.
Okay.
But again, we really need to look at that program. Because one, this postgraduate, as a country, we need to focus. Where is it that we have minimal specialists? I can tell you from where I sit as the person in charge of decision-making and policy at the Ministry of Health, we have enough gynaes as a country.
In the country, okay.
So then we should now be working towards how do we build capacity in these other specialties that we do not have sufficient. For example, NCDs are on the rise. Cancer is on the rise. So as a country, then we need people now to specialize in oncologists. So then we are going to have some discussion there also to neaten that so that any postgraduate is towards filling the existing gap, the specialties that are there in terms of a gap.
Okay.
But those that we already have, for example, gynae,
Not
those
anymore.
then we will say, no.
Not anymore.
Let's fill the gap that we have.
One thing you told me, the deficit of the deficit that we have in the institutions.
Yes.
Could you explain the rationale? Probably, I know we are running out of time. Of the government integrating doctors from outside, the way they did with Cubans, yet we have a deficit. What was the rationale for that? And yet we have a deficit, and we have Kenyans on the waiting list.
For the record, that program, we ended it. I did end it while in office. We said, no, we cannot be having Cuban doctors while we have our own. The rationale by that time was one, and by the way, it was during a similar crisis of a strike. So the government's rationale was to fill the gap in the interim, but equally to have them come and work together with the Kenyan doctors so that then we are able to borrow from their system of primary healthcare. By the way, they specialize on primary healthcare in Cuba.
Yeah.
And those even specialists go to visit patients in their houses. That is what we expected. We even did an exchange program. Some doctors from Kenya went to Cuba, practiced, came back. They graduated, they came back. So now we have the same. We are going to integrate the same.
Okay.
And I hope then the doctors do not push government to looking for doctors from elsewhere.
outside.
Yeah, now that we have sufficient resources.
Because that's what exactly they're doing, bringing other people. You can bring other people because they're pushing it to the wall. As we end the show,
yes,
I don't hold brief for Dr. Amoth. I don't hold, but it's a concern. 5 years acting, it's been advertised again.
Yes.
What are some of the qualifications, and what has disqualified him in 5 years to now extend that after acting for 5 years, you need another one? You need a substantive medical director. What's going on?
One, clarity, to clarify. The advert does not exclude him.
He can apply.
He can apply.
Yeah.
He is not excluded from the application. The issue around that position has been what was put in the Health Act. You know, there's this danger of you put in place a law ring-fencing it for certain cadres of certain people.
Okay.
So anytime public service advertise for that position, because the Act now says that it has to be a medical officer. Other cadres, the nurses are saying, no, we can also make good director generals. The clinical officers, the public health, the nutritionists, other cadres are saying now they can make good director generals as well. So if you look at the advert that went out latest, I think 2 days ago, is that now that space has been opened up and expanded, that if you have a course in medical-related field, that has now been expanded. Based on that expansion, then these other cadres can apply. So now Amoth is applying as well. And I have confidence, given the experience that he has, he should emerge as the best, unless he fumbles during the interview. But I have confidence that he has adequate experience. He should be ahead of the pack.
After 5 years, why don't you just absorb?
I wish it was that easy.
Yeah.
My hands are tied by the law. If it was, in fact, I wanted to confirm him the day I landed in the office.
Really?
If you listen to my speech when I was